Hello, everyone. Welcome to today's roundtable. On behalf of our symplr team, we'd like to thank you for choosing the time to spend some time with us today. We're going to go over just a few housekeeping items here on this next slide before we jump in. First, we're broadcasting live and we're using GoToWebinar as our meeting platform. To minimize background noise, all attendees are on mute, but we'd love for this to be as interactive as possible, so please engage with us by the questions section of your GoToWebinar control panel. Go ahead and drop your questions as you have them throughout the presentation, and then we'll have some time at the end of the call to address. And then finally, we do ask you that you participate in the survey that will launch in your screen after we end today, where you can indicate whether you would like to receive some takeaway assets. Okay, without further ado, I'll pass things over to Dee Donatelli to lead us in our discussion today.
Thanks, Louisa. Hello, everybody. We're so glad that you joined us today, and for those of you who are listening to this broadcast, perhaps at a later time. I'm very excited. I've got good friends and actual customers that are here today with us to talk about their journey and how they are making very good use of the symplr value analysis tool. But most specifically, we're going to talk about value analysis as a journey. As we approach Value Analysis Week next week, we want to take a moment to pause and think about the journey we've all been on, or are yet to take, quite frankly, because as we all know, value analysis is ever changing. So we're going to talk a little bit about those changes. What have we seen? What have Cassie and Ellie experienced in their own organizations that they want to share with you, as well as how to enhance your workflows to really look at the real purpose of value analysis, cost savings, evaluation time, physician engagement, improving outcomes. And then, of course, as Louisa said, we'll have time for Q&A at the end. Real quick, a little infomercial about symplr. If you've not heard about who we are, what we do, Ashley and I are very proud to be a part of this organization as we work to simplify healthcare operations. What does that mean? Well, what symplr has done is over the course of the years, we've acquired a multitude of what we call gold standard companies, all the way from vendor credentialing to provider credentialing, enterprise networking of our providers, in other words, registering them and signing them up, workforce and talent management, compliance, clinical communication and physician scheduling, compliance, quality, and safety brought to you by Midas, and more importantly, those of us here in contract and spend management representing the legacy MD Byline, Hayes Evidence, Med-approved, and most recently Greenlight Medical. So the platform that we are putting together here at symplr will connect all of these multitude of services at a platform. So think about what Epic is to electronic medical records, what Workday, Infor are to ERPs. symplr is becoming the operating platform to connect the multitude of diversity of other disparate solutions, bringing in greater security, higher performance, and a more of a partnership. Many hospitals have as many as 400 disparate different kinds or greater applications across their organization, with cybersecurity becoming so important today. We at symplr feel like we are onto something that'll make operations simpler. With that, no further ado, my esteemed colleagues here with me today, and I will let each of them introduce themselves as we go through. So Cassie, you're up.
Wonderful. Hello, everyone. Thanks for joining us today. I'm Cassie Vargas. I'm the System Director for Clinical Strategic Sourcing at Health First, which is a IDN in Brevard County, which is the Space Coast of Florida. I've been doing value analysis now for about 8 years, been a nurse for about 20 with a background in the operating room. And I think it's so exciting to see what technology and advances have been made in value analysis just in the short time I've been doing it. So I'm very grateful to be here today and look forward to engaging with all of you.
Thanks, Cassie. Ellie, over to you.
And I echo Cassie's sentiments. This is Ellie Kirschbaum. I'm the Value Analysis Clinical Manager at Nebraska Methodist Health System. I transitioned into my role as Value Analysis Clinical Manager about 8 years ago. I'm sorry, 3 years ago. I was a pediatric nurse starting about 8 years ago. Apologies. As I'm new into my role here in the last 3 years, I've really been able to support our health system in the review of new products and existing products, within all clinical areas. And a little bit about Methodist. We are a nonprofit IDN comprised of 4 hospitals and over 30 clinics, an allied health college, and a laundry and distribution warehouse. So I'm very excited, as I said, echo Cassie's comments as far as the opportunity to collaborate with all of you.
Thanks, Ellie. Last but not least, Miss Ashley Brand.
Hi everyone, Ashley Brand. I am a director of spend management here at symplr. I have operational oversight for our value analysis and spend analysis solutions. I am a nurse. My background's in critical care. I spent some time in the hospital in value analysis, and now I'm with our lovely company symplr. So very excited to talk with you all today.
Thank you, everybody. So let's get right into it. Really what we want to do the next hour with all of you is talk about the value analysis journey. And those of you who know me, and I've been doing this for a very long time, I'm so passionate about what we do in value analysis. And I think a lot of it is because it's never the same. No 2 organizations are the same. No 2 processes are the same. Now, there are some leading best practices which we know are available, and I think AVAP does a great job of sharing those with us, and now through the certifications and different things. So we're going to emphasize a little bit today about what we've seen here at symplr using our value analysis tool on some leading best practice. But then more importantly, Cassie and Ellie are going to really talk about their journey, the highs, the lows, the ever-changing environments, and more importantly, at the end, when we're done, you can request, and they have very graciously agreed to share their workflows with you. And you can see their evolution and changes as they're constantly working through that. So let's jump in and talk a little bit. Let's drill down a little bit into value analysis workflows, how they're designed, how they work. Now, sometimes they have to be redesigned because they don't quite work the way we think they're going to work. But I think the evolution is what we want to talk about. Ashley, let's start with you. Open up a little bit about what you've learned talking to various customers across the country in their workflow process.
Yeah, I am fortunate that I get to work with a lot of different health systems across the country. And, you know, that typically starts with implementation. So we have large IDNs we work with, as well as standalone hospitals. We have some pediatric organizations as well, and they're all very different. And implementation is really where it all starts. That's where you have to take a look at, you know, where are you starting from? Are you starting from a manual process? Is it self-built? Or are you looking to implement software and you're transitioning from a different company? So everyone really has a different starting point on what they're using, and also where they're at in their value analysis journey. One of the initial roadblocks I see when implementing software for value analysis is really on 2 different scenarios. One might be an organization that's looking to purchase technology and they don't have a defined process. So they don't really know where to quite start. And then on the flip side, you might have an organization that is very advanced. They might have a very complex process. You know, it could be overly complicated. So for them, it's really looking at augmenting what they're doing and making it more efficient with technology. So what I have found in working with customers is it's best to come with an open mind and know best practices, you know, in the industry, and use that shared with, you know, connections like Cassie and Ellie to make best use of the solution. And it can be hard to really get out of what you're doing in current state and realize those efficiencies that you are seeking to begin with software. One other thing I notice is that you know, it can be hard to be guided as well. You know, following guidance and recommendations, it's really like lending trust in someone to guide you in a process that you own. So a little bit of insight to get you started there on what I see across the country.
Awesome. So with that, Cassie and Ellie, how did you make technology work for you? regardless of where you started, and we'll talk a little bit in a while about the constant enhancement and involvement, but let's start about how did you decide that you wanted to use technology in your process, and where did you start with it? So Cassie, you want to kick us off?
Sure, absolutely. So the way I look at it, and especially symplr value analysis as a tool, is it gives you a replicatable structure and framework. So the technology behind it, the things that are looked at, right? So the clinical evidence, the FDA mod reporting, that helps standardize what you're looking at every time. So you have a consistent approach, and building that trust in the approach is really what causes people to buy in, is saying, wow, this is really a really solid way of looking at it. I remember having a conversation with my CFO about how we reviewed new products and what the scrutiny was that we took them through, because there was an assumption that we just brought things in willy-nilly. This was not too long after I started. So after I was able to take her through the site and say, these are all the steps that we look at. These are all the people from these different areas that we involve to make sure we have a robust review every single time, while also balancing it with speed to value. So that's another, I think, topic we could touch on later, is the just amount of rapid change that happens. So if you have a process that's built that people trust and they're aware of, then you get the speed to value as well.
Perfect. Ellie, how about you? Talk us a little bit about where you started.
So when I started about 3 years ago, our program itself, our value analysis program, was fairly simple, I'd say. It hadn't necessarily adapted to the needs of the health system and the providers, and there had not been much change or evolution over the last several years since the program had actually started. And so as far as coming in, I noticed a lot of friction between our providers, between our leaders. I think that there was a lot of opportunity to take a step back and take a look at what we're doing and how we're doing things, and then how technology fits into it.
So I know both of you talked about, engaging people along the way, and Cassie, you mentioned that technology will give you a more organized and set structure. And you guys know we talk about this all the time, right? The repeatable process. How do we make it work? So Ellie, when you first came in, was there already technology at your organization? Were you already using a system?
Yes, so as we looked at technology, our platform that we used kind of mirrored our process and our utilization of it. It was inefficient and really underutilized. And so when we took that step back to evaluate what are the needs of the providers and those requesting new products, and what are the needs of the leaders, that was really when we were able to take a look at technology and what was available out there, because much had changed and technology had advanced, to find something that was really able to augment our process and what our needs were. And we were able to find that solution through symplr.
Right. And Cassie, we talked about, as we were just prepping here a little bit before the call started, how you've expanded your technology over the years. I know you've been using technology a bit longer. What do you think is the pivotal point that you're kind of at on how you're going to use technology more to your advantage moving forward?
Yeah, so I think technology is a force multiplier. We're all being asked to do more and do more scrutiny, more review, involve more stakeholders with more transparency. Choosing the right technology can accomplish many of those goals for you, keeping in mind, though, that it is still a tool. You need to set the system up for success and do the right education at the right time. Like Ashley mentioned, the implementation is absolutely key whenever you launch a new platform or program to doing things. You have to get people to trust the process, acknowledge that it may seem a little bit scary or uncomfortable sometimes at first, especially if they're used to doing things the way they've always done, or they had a paper system that people say works just fine. That's absolutely a challenge, especially for larger IDNs that may have separate value analysis teams in different networks. You want to ensure that the rigor that is applied to a product coming in one network would be applied the same way in another. So when there is a new product that comes in, you know that all those things have been reviewed and it is a sustainable choice for the organization to move forward or not move forward.
Perfect. I love it. Ashley, you mentioned that effective implementation is the key. And I know sometimes here at symplr, as we work with customers bringing up technology, they have maybe greater expectations than we can meet by our technology. What is some of your sage advice, having helped a lot of customers across the country now implement? What would you advise our audience to expect when they invest in technology, or to think about as they use the technology to the best of their advantage? What are some of your thoughts?
Oh, yeah. I really look at this as a blending of processes, right? So you have your own process, and when you implement technology, it's really marrying the two. So it's your process, but a bit modified, so you see those efficiencies and those wins that you're looking for. So it's not always following your current structure. So step A to step B to step C and plugging that into a software. It's almost a development of a new, more efficient process. Now, we're always looking for ways to make our technology better and get additional wins for our customers, of course. But going back to that, coming in with an open mindset and really trying to follow best practices or guidance for use of that particular technology is helpful. I think that's the key to success.
So with that, Ellie and Cassie, when you brought in technology, or as you continue to enhance the use of technology, did you have to change your process? Did you have to make alterations in the way that it flowed to match the software? Or how did you do that? Ellie, let's start with you.
Sure. So we, much like Ashley mentioned, we really took that step back and blended industry standards in our research in that, working with mature value analysis programs, resources through AVAP, things like that. And then, of course, with the symplr team in terms of what that process within the tool looked like. And what we found was that symplr really mirrored what the industry standard and what areas really should be involved in terms of a robust new product review process. And we were able to blend what our health systems needs were into the system, into the tool itself. And so in terms of adapting, changing, adjusting, of course, there was some of that, but we found that honestly, it was truly for the better. We found a tool that we were able to not just standardize the way that we look at new product review, but create certain efficiencies as well. And so, yes, there was change, but it was a much needed change. And from anecdotal feedback from our providers and from our leaders that are involved in the process and have been touched by it, honestly, I think a welcome change.
Interesting. From a historical perspective, and Cassie, I'll ask you the same question, but I know when Austin Dirks founded Greenlight Medical, and actually way back when I actually was on the advisory board with Hanny, when he stood up Lumiere, and those of us who have been around a long time recognize both of those pioneers, they went into establishing this software with a mainstream best and leading process in mind. And so really what this boils down to for the audience is that a lot of the frustration that we see with customers adapting to technology is they're trying to force fit. And I think one of the mistakes all of us make is that we feel like we have a well-orchestrated, well-planned out value analysis process, but when we take a moment to really flow diagram it, to really think through it, we can always find areas that perhaps could be improved. And by following just the basic tenets of the step-by-step through the workflow process, And I remember here at symplr when I first came and was working with some of our executive leadership, defining and explaining to them really what value analysis was, as I know you guys do probably every single day with some type of a leader in your organization. You know, I remember one time and now these are software executives predominantly, they're like, oh, that's a decision support tool. Said another way, that's absolutely right, you know, when you think about industry. So Cassie, what were some of the other lessons learned, similar to Ellie's or different at Health First, that you came up upon that you had to modify slightly to make it work? What are some of your thoughts?
Yeah, so I think that's a really good point. It's a decision support tool. So the question then becomes, is the current process, and that's what we had to look at, was the current value analysis process gathering the right information for those members that were voting to make a decision? Did they have all those pieces that they needed? And so it was going back then, and you have to kind of continuously reassess as you get new leaders in the organization, as the org structure changes. Do you still have the right folks in place? Do those leaders still want the same information previous leaders did? Maybe they have new asks. And so that's where I see it being a great tool to be able to constantly do that reassessment, because there's not necessarily fixed points. You can do custom questions, you can adapt, tweak, and modify. And so for us, it was opening up the value analysis process to what we currently had, doing a lot of education and training on what the capabilities were, and then deciding, okay, what are the core pieces we need to keep that are beneficial? What are things that are just clutter that are getting in the way? Because I think sometimes, I know I'm guilty, I tend to overcomplicate things. It's easy to do, but that was the thing. It gave us a chance to open up dialogues with different teams to really say, okay, what do you need? Or what questions do you need the vendor to answer to help you provide the information? So if you look at value analysis as a facilitator, gathering all the information so that leaders can make an informed decision, it really helps shift the mindset, I think, into how do you blend old with new, and then how do you keep moving forward to keep things fresh and not stagnant.
I love it. Ellie, I'm going to pick on you as the newbie since you've only been doing this for 3 whole years. I just remember when I first met you, it's like, oh, this lady totally gets it. You got it from the very beginning. But what would you, you know, when I tune in as an audience and I want to listen to quote the experts, I want to walk away with what would be that one aha moment that you think you had in your 3-year journey that you would want to impart with our audience today, particularly around how you are managing your process and maximizing technology to do so? What would be some of your thoughts? And Cassie, I'm going to ask you the same hard question.
Gosh, that's tough. Value analysis is something I'm so passionate about. It's truly not just about reviewing products. I'd say if I've learned anything in the last 3 years, it's truly about building relationships and trust with all of those individuals that we're connected with throughout our health system. I mean, healthcare is hard enough to navigate, and so we are tasked with doing that with new technology coming in constantly, and it's challenging. But what I've found is value analysis, while yes, it's incredibly complex and we have tools and things to help us, you know, augment and create efficiencies, I truly think that what matters most is the people that we serve. So providers, leaders, patients, our community. While we have access to all of those different tools and processes, things like that, I think that it boils down to honest and open conversations, and that's where, you know, we've been able to make the most movement and forward progress in our program. That trust makes our workflows and the tools that we use actually work, easier to implement, like Cassie mentioned. I think healthcare, like I mentioned, is intricate, it's complex, and so any little bit we can do to help streamline the process, I mean, all of it's going to be valuable in the end. It's really an upstream way of thinking.
No, I think it's perfect. And I know that when we prepped a little bit, you said, it felt like at first there was some friction in the process, and over time, building those relationships and having an openness to constantly listen. I know as my years of consulting, one of the things I think that my tip and technique to success is that you want your end users to feel like they're part of the process, right? That they have a say, that we want to make sure we have all the right information to make the right decisions. So Cassie, what about you in your journey? What would you say is a major turning point for you? How would you describe it?
So I think it goes back to, I remember in nursing school, I had an instructor that said, just remember, when you're out there actually working, the human body has never read a medical textbook. So you can absolutely lay your foundation, use those AVAP resources, use other experts in the industry as well. But keep in mind that chances are your hospital leadership probably has never read a value analysis handbook or playbook. And so you need to be able to adapt and be flexible. The best value analysis workflow is the one that works. So even if it looks modeled maybe a little bit different, that's okay. I think the nice thing about symplr is that it has, again, that standardization and structure to make sure you have all those pieces together, but then how you move forward with that and who's involved can vary greatly from organization to organization. So keep that in mind. Organizations are kind of like living creatures. They change over time, so just be prepared for that as well. The organization I'm at looks very different, 4 years later than it did when I first started working there. So as long as you keep that in mind, I think you will be in a good place.
I love that. It's an ongoing process. You guys hear me say all the time, there's no right or wrong.
Right.
There's best sometimes, but Ashley, before you came to symplr, you were in the thick of things at UPMC doing value analysis. So, I'll ask you the same question just for fun. What do you think was kind of a turning point that made a difference in the way that UPMC was doing it, or perhaps that you've gleaned from customers here at symplr, kind of those exciting aha moments when someone like gets it or it clicks or it's like, oh, we finally kind of got over the hump?
Yeah, no, I'm thinking back to like baby nurse Ashley in her 20s. What has really excited me over the years is the increase in visibility and transparency. So thinking back to when I was, doing value analysis projects in the hospital, there was no visibility. No one saw what I was doing or what our sourcing team was doing, unless you were on a team and you met in person or like on a video cam. It's so different nowadays, the visibility and transparency that is there. And I honestly think that has helped to grow value analysis as an industry, because if people don't know or they don't see what's going on or have a part in the process, then you're not going to hear anyone talking about it or be invested in it. So to me, the visibility and transparency has been the real exciting thing.
I think you're right about that. And I think, Cassie, I think your quote will go down in history that, the best process is one that works. I love it. So,
yeah,
and that's the perfect segue to go into kind of our next topic, and that is, how do we make this all work to drive to success overall? And, let's face it, as much as we all talk about it and we believe it as nurses, that value analysis really is here to make sure that we're providing the best care for our patients. And that I think I would like to believe is tried and true no matter where. But we all typically work in supply chain. We all typically work for organizations that are struggling to maintain margins, particularly with the economic pressures. Cassie, you're there at Premier right now, and I'm sure you're hearing all about the economic pressures and tariffs and increasing costs and all those kinds of things. Time is precious. The amount of time that it takes to evaluate the process, we've always the age-old, why does it take so long to make a decision, right? How do we get doctors and the right people involved? You guys have heard my mantra of, don't just have a committee for having a committee. have a group that you stand up and you collapse and you use them and you make decisions more expeditiously. And I truly believe that technology can help us do that better than really anything else. Do we need to meet in a room anymore, to Ashley's point, to be on a committee? Or can you have a rapid deployment that makes better decisions and improving outcomes is always our end goal. So with all that being said, Cassie, why don't you kick us off and talk a little bit about how you're using your workflows to drive success. More importantly, speed, perhaps. Well, no, you know what? I'm not even going to call that out. I'm going to say, what do you think is the most important thing that your workflow can help you accomplish? I'll put it that way.
I think it's looking at kind of maybe flipping a model that a lot of us were used to, and engaging the physicians and clinicians from the very beginning. I cannot stress how important that is. A lot of times resistance that you get is really because people don't know. And given all the things that are in the news and talk about tariffs and healthcare and cost, I think we're in a really unique time where people do want to be engaged. I have more physicians asking me, how much does this cost? How can I drive my cost per case down? What could I use instead of that? Which is exciting. That's something that is value analysis. That's like music to our ears that we hear. So engaging them from the beginning and helping them understand the total picture can save you a lot of time. Actually, it may seem like it's slowing you down, but I've had conversations with physicians to say, hey, let's go ahead and look through this product. I'm going to ask you some questions. And as we go through, they're like, actually, I'm really okay. I don't need that. And that's great. If that's the choice that they feel is best for the patient, then I support it. If they still feel it needs to move forward, then we'll have all the right stakeholders engaged and we will understand those impacts, as well as then open up a conversation about, okay, if we're driving cost up in this area, maybe there's another area we can pull cost out of. So I think of it less, like a committee. It's a conversation. Everybody should feel safe and comfortable to participate in. So I think that's an essential part of a workflow as well. Maybe that's a little bit more intangible, is building that in. But the workflow will keep you on task and on target. Make sure that you are doing those minimum review requirements for safety, to make sure that the product is tested, approved, all of those things before it comes in and touches a patient.
I think that one of the things that I have always brought to the surface is to make the intake questions just tough enough that, it allows the requestor to really rethink, why am I asking for this, right?
Yeah.
Because when it comes right down to it, there's no bad products really. There are products we prefer, right? Or that are on contract or whatever the case may be. But I think that you make a very good point. Ellie, how about you? What's kind of your answer to my question? What do you think is the most important process or part of workflows?
Gosh, I was smiling while Cassie was talking because I feel so many of the similar things, I think, within our program. As far as the most important thing, I think, again, transparency has been key, so important in building trust and creating efficiencies in the process. Like Cassie mentioned, having them part of those intake questions so they can really see the things that we're looking at. And having those questions be customized through symplr, I think, has been our balance or our blend between industry standard and then what our key stakeholders really want to know and really what our sponsors should be able to provide. So I think that that's where our balance has been. And as far as transparency in the process, we actually added a step within our workflow in terms of our full review process. So certain items that reach a certain clinical impact or financial impact need to be presented in front of a new product committee. And so when those items meet that threshold, we actually ask that the sponsor attend that meeting to speak to essentially the questions that they answered within symplr. So our slide is actually those questions on a slide and they speak to it. And then we speak to some of the financial things so that, again, we're building transparency around our new product review process. I mean, we talk through some of the risks and barriers associated with certain products and requests. And of course, we have these conversations ahead of time with the providers. And like Cassie mentioned, sometimes they hear the barriers and they're a little reluctant to move forward, which of course is their decision. But for those that do move forward, they're part of those conversations. And we've actually added to that process where we have an element that involves peer-to-peer discussion. So our chief medical officers actually sit on that committee, which has really added just a whole nother layer of value to our process, I think, in terms of new product review. So I'd have to say that transparency's been key, and symplr has been able to provide that in terms of a tool to facilitate.
Awesome. So a couple of things, what you both have said have kind of spurred thoughts in my mind, a little off script, but you guys were prepared for that, right? How do we measure success? And more importantly, how have each of you evolved your committee or process structure? So we're talking about using technology to help us, and I kind of believe that technology is sort of behind the scenes. What about engaging these people? How are your meeting structures set up today? Has that changed over time? Because you're, Cassie, you're in an IDN, not just one building. Well, none of us are in one building anymore, regardless, right? Back in my old day, we'd sat around a desk or a table at 7 in the morning and had donuts. That doesn't happen anymore. I realize that in most organizations. So how do you measure success, and how do you share that? And how is your organizational structure working? So, Cassie, you're shaking your head. You want to start?
Absolutely. So as far as kind of what we've done to change structure a little bit is thinking to, again, going back to who should be engaged. This last week, we had a really great spine. We have a separate spine value analysis team because it is so specialized and so expensive. But it was one of those times when our providers, we built trust with them. So they think that what we're presenting has value and they appreciate it. And they talked the entire meeting, which was wonderful. Because I think if you've ever been a value analysis leader, you know what it feels like to have crickets. But the cool thing is when you engage providers within specialty fields, for us, it was they were asking questions that I would have had no idea to ask. They were questions really from a peer to peer. And some of the questions were questions that I would not have been comfortable asking because I'm not a doctor. So I think that's something that has been enhanced over time, absolutely. And then I'm trying to think of what other things. Yeah, I think that's it. Kind of assess the granularity. Obviously, you don't want to be too granular, but you don't want to go too broad. So think about where you're spending the most money, right? It's kind of the 80-20 rule. Where are you spending the most money? And then how do you get high engagements out of those teams? And also set a strategy. Talk about where do you want to be in 3 years as a spine program, as an EP program. What do we think the growth needs are going to be? What equipment needs? So you can start then to map out what that is. And if everybody agrees, they'll be a lot less likely to listen to a vendor maybe that wants to bring in the newest, latest fad thing. So I think that's helpful in getting everyone aligned, is making them part of that process. And some of the way we do that is just by engaging as broadly as we can within specialties.
Do you have key performance indicators? Are you measuring cost reduction by committee or by initiative?
Yeah, we do. So we do track that, which is great. We just use in symplr value analysis, the financial dashboard. We use that to track. I'm in a unique position, so we've merged our value analysis and our contracting to the strategic sourcing now. So we are responsible as well for a larger savings goal. And then our other goals that we have are on-off contract spend. So that's something that we work on. We look at unit price change as well, inflationary aspects. So there's a lot of things. We did in the past look at turnaround time in terms of days, but we moved away from that once we felt that we had the process nailed down. So I think it's important you keep KPIs meaningful so that you don't just have it be a thing that you gamify to meet, right? You want it to be meaningful and to drive change that needs to happen in order to meet the KPI. Once your system or process is laid out and has been followed and is solid and you can see you're meeting those, look for a new KPI that will challenge you to say, okay, what do we need to improve about our process? Let's set a KPI here. And then organically, you're going to work to meeting that goal and things will change internally.
Think about an example of that and we'll swing back. And is decreasing time to decision important? Does it matter?
It does.
Yeah.
I know, it does. It really does. It's so competitive, depending on where your hospital systems are located. There are external pressures from competitors to be the first to get to advertise. We have, I'm just going to use this as an example, y'all. We're the first that has PFA. That's one that was definitely like, you know, we've got to figure out, does this add value to the organization? And then how do we make sure that we get everyone aligned, understand the impacts to be able to move forward rapidly? So actually, one of the things that I did within symplr, because I've had conversations with the leaders for different areas, and one of them was, okay, well, sometimes we have things that are priority that maybe are discussed in meetings I'm not privy to in higher level strategy meetings. That's great. So
Sure.
in the hospital administration step, I educated my leaders, but I gave them the ability then to select a, I think it was a category. I want to say it's a category that I added as a custom to say like, this is a priority, like a strategic priority. So that way, when we do get things that move into active review, I can say, oh gosh, okay, we have one that's a strategic priority. Let's front load this to make sure that we're working on it, because our leaders would get frustrated sometimes, and typically we work in the order that the requests are received. So sometimes things that are lower down the list we wouldn't get to, and that was frustrating leaders. And so that was a really simple solution to say, hey, just let us know by doing this, and we'll make sure to prioritize it so you're not getting frustrated, your providers aren't getting frustrated by what they perceive as slow by supply chain or slow by value analysis work.
Right, perfect. Ellie, same hard question. Key performance indicators, and how do you stress those, measure those, make those happen?
I would say early on, when we adopted our new process and then symplr as a tool, we were really curious about efficiency and then engagement. Those were two big pieces. I think that, you know, people will participate or engage in things that they find value. And of course, that's something that is always at the center of what we do. We want to make sure that what we're providing to leaders, what we're doing for providers is providing value. And so engagement was something that we measured in terms of surveys, and we actually surveyed both our clinical leaders that are involved in new product committee, and then we also surveyed our sponsors too. So anyone who had participated or sponsored a submission through symplr, we actually sent a survey to them just to get their feedback, of course, always in the mindset of continuous improvement. So early on, we actually found, in terms of numbers, we found early on when we had our first survey, I think it was 13 of 14 different specialties had actually filled out the survey, or I'm sorry, sponsored questionnaire through symplr, and then attended new product committee as a whole new process. And this is totally different from what they were used to. I mean, we rolled out the process, we anticipated friction. You know, oh, I've got to fill out a question. It's, you know, there's definitely, in terms of length, it's maybe doubled because we're trying to get all the right information much sooner to the leaders. And so we thought that there would be some pushback from providers in terms of participation. What we found was that they were engaged. They were excited to be able to vouch for clinically why they think that their request would be beneficial for our health system. And so I think we thought that there would be friction with this extra step and a meeting that they would have to attend, but we really found that, 13 or 14 different specialties, that was fantastic for us. We were really happy with that. And then efficiency was another item. As far as efficiency in the way that we looked at this KPI, it was time from submission until a decision point. And so what we're measuring here was truly something submitted through symplr, that whole review process, so our front end value analysis, initial look, and then as it moves through either full review or our fast track pathways, how long is that taking? And what we found was prior to this process and prior to symplr, our requests were taking anywhere from 2 to 4 months, potentially, depending on complexity. It was taking some time to move these things through. And of course, that's frustrating for leaders. That's frustrating for providers. And without constant touch points and without symplr at that time, it was challenging to keep them updated given our volume and our bandwidth. So those things were challenging. And so what we found moving to symplr, while our request went from 2 to 4 months, our process now is 1 to 2 months where we're actually seeing decision points. Our leaders are getting the information much faster, much sooner, and they're much more comfortable with the process. We realized too, as time went on, as far as our new product committee review process and the use of symplr within that process, leaders were getting the information that they needed to not necessarily make the perfect decision, but they were making the best decision that they could at that time, feeling comfortable with the financials and the clinicals that were provided and the dialogue with the providers that were attending the meetings. We found that we're actually making decisions much faster through that built-in trust and then visibility of the request using the tool.
I love it. Those are great examples. Ashley, do you have any customer examples of any additional KPIs that come to mind to share with the audience?
I did a whole recorded session with Cassie on KPIs. So honestly, listen to that because a lot of great insights from that. So no, I will pass.
Perfect. What do you, if we have new customers, Ash, what do you typically suggest to them? These same things that we just talked about as the beginning measurement points on their overall success?
Yeah. If you are net new to implementing technology, I think turnaround times, collaborators that you have, those are all things that you should be tracking initially and looking to improve down the road and having better informed decisions. But what I think on this slide, it's enhancing workflows, and that's what I get most excited about. I get the opportunity to meet with different organizations a year down the road or 6 months down the road after they've first set up their technology. And when you start, it can be all new and fresh, and you think you have it set up just the way you want it, and it's going to be perfect. But we all know life is not perfect, and in reality, there's always areas you can optimize. So this happens all the time. Our customers get very surprised at what they can do. It could be a little overwhelming in the beginning, but just taking a look or a different set of eyes to say, hey, this is how you set it up initially. Did you know you could have, more than one sign off in the beginning? You could bring in a leader at this point and have a second set of eyes and save some time down the road if this is going to be shut down initially. Or did you know you can add an owner to each individual submission? So you might not catch that right in the very beginning. There's a lot of different options and little things that can be done to really enhance and optimize your process along the way. So I love the look backs and taking a second set of eyes.
I think that's good. That's great. My sage advice is kind of silly, but when I set out to reorganize my closet and I pull everything out of my closet and pile it on the bed, I'm totally overwhelmed. I'm like, oh my gosh, why did I start this project on this beautiful Saturday afternoon? But then on Sunday, when my closet is all much better organized, I feel so much better about it just because it's systematic and it's organized. And then Ashley, to your point, several months later, I can keep it more organized. I can follow a more standardized routine. So I love that analogy. We want to open up to questions. I don't know that any have come in as I look at the chat. But in the last few minutes that we have, ladies, what parting words of wisdom would you like to share with our audience? I know we're all passionate, and I can't thank you enough for taking time out of your busy days to join us today, but I love what we do. I am constantly looking for ways to make it better. We want to hear from all of you. I can't thank Ellie and Cassie enough for their willingness to share their workflows with us so that we can then share them with our audience. So if you would like copies of those, hard copies, we will not hard copy them. We will email them to you. We won't be faxing those over anymore. We will send you those and you can look at them. But I think what you'll find is what we found when we looked at them is the evolution has been great. It's an ever-changing process. If you think that you've got it perfect, then maybe it's time to think about what perfect could look like moving forward. So evolution is part of the game. Ellie, parting comments, thoughts, words of wisdom to share on the use of technology and making your workflow work for you.
Honestly, technology is here to help automate some of the processes where it makes sense. It's here to make our roles within value analysis just a little bit easier. We could use all the help we can get, to be honest. Finding something that works well for your organization is so important, obviously, for buy-in as far from the leadership level and providers as well, making sure it makes sense for you and choosing a system like we did that allows for some customization so that you truly can make it your own, but ensure that you're not just, creating a new process. You're setting a new standard, to be honest. Personally, value analysis, this role has given me a lot of perspective. Starting as a nurse at the bedside, I did not have a lot of visibility to the financials, to a lot of the things that happen. I thought a supply fairy came and filled our clean supply room, and I wasn't sure, the whole world of back orders and supply chain disruptions and all the other challenges that we have. Honestly, use the tools and make sure that you're balancing both clinical and financial outcomes. That's so important to make sure that you're serving the people that truly were meant to serve. Moving forward, Dee, like you mentioned, continuous improvement, keep that at the core, as well as trust and communication. I think you'll be just fine.
Great advice. Cassie, what do you have to share with our audience in closing comments?
Couple things. So I think one, I'll echo Ellie's sentiment that keep the patient in mind through all of this. It helps guide you. It can be your North Star. So in terms of how you approach things, it really changes your viewer perspective, saying, how will this benefit patients in a perceptible, measurable way? Will this bring betterment to their lives and their health? So keeping the patient focused first is huge. I like to level set every meeting to say that's what we're here for, is to focus on how will this product improve the health and wellness of the patients that we serve, and get folks into that mindset of what are we bringing in. The second thing I wanted to mention is I think value analysis is so cool. There's not very many of us. It is a growing field, yay. But definitely every person that I have met in value analysis has always been so welcoming and open to share tips, tricks, how they do things. So lean on the community for value analysis, absolutely. Phone a friend, you can call me, I'm sure you can call Ellie as well. But also be aware too that within symplr, they can offer you that guidance. They can connect you to other health systems that maybe are doing really well with symplr value analysis to share their tips and tricks, because I really believe that in healthcare, with the challenges we're facing, we are better together to be able to face those and meet the needs of the patient at the end of the day.
Great, that's perfect. And Ashley, on that, a little plug. I know you have worked, you mentioned a little bit ago the recording you did with Cassie on KPIs. Remind people within the tool, anybody who might be a user today, where to find some of those tips and techniques that you've made available to our customers.
Sure, absolutely. So when you are logged into our website, we have a little chat bubble in the bottom right. But if you click into that, that actually contains a lot of different best practice resources. There's recordings from some of our customers on key topics around value analysis. So feel free to access any of those materials. You can just click that chat button and search through what all is available. There's education in there too on the solution.
Thank you. And in closing, a couple of things that I would mention. Number one, I too love value analysis. You guys know I've been doing this a long time. And I think my piece of advice is we all need to give ourselves a little bit of grace. There's a lot going on, a lot in our world in general, let alone every day when we come to work and we face making decisions that do make a difference in people's lives, those of our patients in particular. So as we embark upon the value analysis celebration coming up next week, let's graciously reach out and put our arms around each other as we continue to support one another. No place more than here at symplr. Ashley and I are available to help, to connect, to network or whatever. And a couple of things coming up. We're going to do a value analysis open house in August. So constantly talking about the process and giving demos of how our value analysis tool works. Certainly you don't have to wait till August. We're happy to share that with you anytime that you'd be interested. You can register today or reach out to us. We're going to be at ARM. Ashley actually is speaking with Gloria Graham on pediatric use of value analysis. And then we're going to be hosting a happy hour on Tuesday. Actually, I think it's on Tuesday, or excuse me, Ashley's Learning Lab is on Monday with Gloria, and we will be hosting a happy hour on Tuesday afternoon from 5 to 6. We're excited to talk about, we're embarking on some use of AI here at symplr, and I would love to hear more about what we think about. That's a whole nother hour conversation on the use of AI in the future in healthcare and specifically around value analysis. So those things are available. Also ping us after this. We will send you those workflows. We'd love to share them with you. Cassie and Ellie, again, you guys are awesome. Love you both. Love that you've taken time out of your busy to not only be here today, but to prep and to get us the workflows and all that, because I know it takes effort as well. So thank you, thank you, thank you. Very much appreciated. And thank you all for joining us today. I hope this was a worthy hour of your time. Hopefully you had some lunch while you were listening in. And now we can be off and have a good rest of the week. Thanks you all. Take care. Till we meet again. Bye, everybody.
Okay, thank you.
Thank you everyone for attending today, and a huge thank you to our panelists as well for sharing their journeys and best practices. As you head out, you will see a quick survey pop up where you can indicate whether you would like to receive the value analysis workflows from Nebraska Methodist and Health First. Thank you again for joining, and we hope you have a fantastic rest of your day.
Thanks, Louisa. Bye-bye, everybody.
Bye.